Thanks for watching the Medical Class 901 with Dr. Chi MD.
Welcome to Medical Class 901 with Dr. Chi. I am Dr. Chinelo Animalo, infectious disease and HIV specialist and a professor of medicine at UT College of Medicine here in Memphis. So this is a show where we discuss different and various types of infectious diseases and infection. And in prior episodes, we've talked so much about HIV because this is something that is becoming so rampant in our country. So today our show is going to focus mainly on prevention, and we're going to talk about PrEP and PEP. These are things that are very common in the HIV world. So what we're going to do right now is more like going to be like a medical class. So please bring out your papers, bring us your pen, and let's get to class. All right. So I'm going to start with prevention of HIV. Prior to going into that, the first thing I'm going to do is kind of review the modalities of spread, like how do people get infected with HIV. This is something that we have talked about several times on this show. So the commonest mode of transmission would be sexual, meaning any kind of sexual intercourse, be it vaginal, oral, or anal sexual intercourse. Any kind of situation where there's a break in the barrier or the mucosa of the body, and there is some kind of exchange of body fluids between two people, that would be the commonest mode of transmission. Then of course there's something that's called the vertical transmission, where a woman who knowingly or maybe knowingly knows she's HIV positive does not get care and passes it down to her unborn baby. Another mode would be sharing of needles. This could be perhaps among the population of people with they use IV drugs, or even somebody that perhaps takes insulin and you share your needles with other people. This would be another common mode of transmission. So in terms of prevention, we kind of will start by addressing these modes of transmission one by one. So let me start by, being a woman myself, the fetal-maternal transmission or the vertical transmission. This is where a pregnant woman transmits the virus to her baby because she had untreated HIV. And so where can, one question would be like, how is this possible? And so, for instance, a woman who did not receive care, prenatal care when she was pregnant, did not know she has HIV, could easily pass it down to her unborn baby. So we do encourage women, whether you're insured or uninsured, to please, go to the nearest clinic, plug yourself in with a doctor. There's so many facilities here that will take care of you for the fact that you are pregnant. And part of the workup or the test that is done would be to check you for HIV. And if for some reason that happens to be positive, then the normal thing would be to put you on HIV medications to prevent you passing this infection onto your unborn baby. Then another thing would be to encourage people do not share needles. So, regardless of, if you're an IV drug user or any other kind of situation, maybe you take, shots for diabetes, insulin or whatever other reason, please do not share your needles. Blood transfusion, could be a mode of transmission in maybe some, developing countries, but this is not something that you're going to see here because the blood that we use here is well screened for HIV and other infections such as hepatitis B, hepatitis C. So it's going to be very unusual to have this kind of spread. Another uncommon one would be spread amongst healthcare workers. And so we call it like accidental splash. It could be a doctor who is operating and, accidentally cuts himself, or this is splash of bodily fluid on the, doctors and nurses, or a nurse is trying to draw blood from a patient, accidentally sticks herself if patient is HIV positive. So these are, the commonest modalities of transmission. So what we're going to do now would be to talk about prevention. So how do we protect ourselves? How do we prevent transmission of HIV? So this would take us, to, we call it PrEP, right? Prophylaxis. So I'm sure, most people who are familiar with this infection would have heard about PrEP. PrEP stands for pre-exposure prophylaxis. Okay, what is prophylaxis? This sounds like some big name. Prophylaxis is just a medical term for, would I say, things like prevention or mode of, stopping spread. Like when you anticipate that you could get, an infection, and we give you something to prevent that. So that's basically what the word prophylaxis stands for. It's just a medical term for basically prevention. All right, so PrEP, as we talked about, pre-exposure prophylaxis, is basically what measures, what you do to prevent yourself from getting HIV if you fall into a high-risk population. So before I delve into that, let's talk about high-risk population. What are we going to consider high risk? So one would be, for instance, if you are sexually active with someone or people that you do not know their HIV status, basically unknown HIV status. So this individual you are involved with, are they HIV positive or negative? You don't know. So that will fall under high risk. Another population would be if, for instance, you have multiple sexual partners. So, maybe every weekend there's somebody new or something, but that also puts you under high risk. And again, if you're in a situation where you have to reuse needles or share needles, these are things that will put you at high risk. Sexual workers, people that have sex for money or for, in exchange for other things could also fall under this category. So these are people that PrEP is available for. It's available for me, it's available for you and for everybody else. So let's talk about that. Something I would really wanted to talk about again would be, abstinence. So for some people, abstinence might be an option. What does this mean? If you're not sexually active or you kind of want to keep yourself till you're ready, then that will be something to consider. So we are going to take a very quick break, and then when we come back, we'll delve into PrEP and PrEP. Thank you. Thank you for tuning into Medical Class 901, a show where we discuss the common infections we see in our communities. I am Dr. Chinelo, animal infectious disease and HIV specialist. So remember to tune in to Xfinity Channel 17 and 1091 on Mondays at 7:30 p.m. So see you then. Welcome back to Medical Class 901 with Dr. Chi. I am Dr. Chinelo, animal infectious disease and HIV specialist. And on this episode, we are talking about prevention of HIV. And so just a quick recap, we talked about the modes of transmission, what we consider to be the high-risk population, and the indications for PrEP. And so that's kind of where we are right now. So I'm going to talk a little bit more about PrEP because I'm sure you've seen the adverts on TV, from different pharmaceutical companies talking about PrEP and PrEP. So we already talked about PrEP. This stands for pre-exposure prophylaxis. These are medications that we give in patients or people who are considered high risk for contracting HIV due to either sexual practices or what we call, behavioral, modalities, or due to epidemiology. For instance, those people that live in places like Memphis, like myself, Houston, Miami, these are places that have, significant cases of HIV. So you want to be safe. All right, so so the question would be, you keep talking about PrEP, Dr. Chi, how do I get this? Or, how do I, obtain this? Do I have to go to a doctor? Absolutely. So there are doctors around the town. You have infectious disease doctors such as myself and other doctors and primary care doctors whom you can go to. You also have some places like Friends for All. You have some nonprofit organizations that participate in HIV care. And so PrEP gives you about 99% protection from contracting HIV amongst people in this high-risk population if you take it according to your doctor's prescription. Okay, so I will talk about that a little bit. So, who can get PrEP? Anyone can get PrEP. Anyone that feels that they need it, that they fall into this high risk category, or or kind of anticipate that they might be in the high risk category, then you also can get PrEP. All right. So, what are the indications that we talked about? Not knowing, someone else's sexual status, somebody you're going to be involved with. So PrEP works when you take it in a timely manner. So let me give you a typical scenario. Let me just create a typical scenario. So we have a young lady who, maybe was out in the club, had some kind of sexual intercourse with a male, and not sure, this is 48 hours later, not sure, if this person has HIV or not. You come to the doctor. What we're going to do is to put you on medication to prevent you getting this virus. So what these medications, these are all HIV medications that come in combinations. They're not like one single pill. So you have, some of them are 2 pills in one. And I'm gonna talk about those in a second. And what happens is that we give you this medication. What it does is to prevent that virus. If there's any virus, HIV virus in your body, what it does is to stop it from replicating, meaning from multiplying and causing you to have that infection in the future. So there are various types of PrEPs that are available. You have 2 categories. You have the orals, which are the common medications. I'm sure everybody has heard about Truvada, Descovy, and then you have the injectables. These are the ones that you get the injection. So I'll talk about them separately. So before we start you on PrEP, there's the most important step is that we must make sure you are HIV negative. If you, during that initial screening test, is HIV positive, you cannot get PrEP. We now have to put you on full-blown treatments for HIV. So this is very, very important. So if you show up in the clinic or you go to your doctors, before we give you PrEP, we must test you for HIV. Now, if you're negative, then we will go ahead and put you on PrEP. So like I said, you have various types available. So it will depend on your doctor based on your kidney function, your liver function, your blood levels, and other underlying medical diseases or illnesses. You have to decide which of these options will be the best option for you. Then we do a lot of counseling, right? Because if you are, I see a lot of people, they're like, I don't like to take medications, and stuff like that. This is something you have to take every day. So we always talk about counseling the patient to make you understand, the risk and benefits of taking PrEP. But in my own professional opinion, if you fall into this high risk category, I mean, it's a no-brainer. Like I would take the pill daily, compared to risking, getting this infection that is a lifelong infection. So, and another thing that we would do at that preliminary visit would be to, in addition to HIV, we would check and see if there are other infections. So just like HIV, things like hepatitis B, hepatitis C are viruses that you will contract exactly the same way you would contract HIV. So we will also check you for things like that. We will check you for other STIs, as sexually transmitted infections, such as gonorrhea, chlamydia, and if there's any of this present, we'll go ahead and treat you in addition to providing you with the PrEP. So let's talk about the oral medications for that. Truvada, like if I have to take a poll, I'm sure everybody has seen that advert, on the TV. They talk about Truvada, which is part of what you're gonna see with Biktarvy. You're gonna see so many, adverts on TV on these drugs talking about PrEP. So Truvada will be the commonest one, together with Descovy. All right. And so these are pills. They're actually 2 pills in one. So for instance, Truvada contains two medications. We call it Tdaf and FTC. Basically just means tenofovir, anacetrapyl, and emtricitabine. These are the two medications that you have in Truvada. And then you have Descovy, which also contains a tenofovir medication as well as emtricitabine. I'm not trying to confuse you guys with all these medications. That's not important. Just know that these are medications that contain two active HIV medications in one pill, so it makes it so easy. So instead of having to take several pills, you're just taking one pill a day. So for someone that's had, maybe anticipate they're gonna be, maybe find themselves in a situation where they might have unprotected sexual intercourse, you wanna start this medication prior to that event. But let's say, again, like the young lady example I gave, you find yourself in that situation, it's occurred already, what do? If you take PrEP within 72 hours from that index episode, the chances of you contracting HIV is almost nil. Okay, the earliest you take it, the better it works, but usually it needs to be taken within 72 hours. If you take it after 72 hours, I don't know, it could 50-50, percent kind of thing. So you want to take it as early as possible. For those who are perhaps gonna, in a relationship with somebody that has HIV, but is not well controlled, then you want to start PrEP as soon as possible. Again, this is medications that are taken daily, so you want to take it every single day, and as long as the risk factor is there. Now, something I would like to, mention as we're talking about this is, I'm sure you guys would have heard from maybe CDC where they said undetectable is equals to untransmissibility. And what that means basically is that if you have someone who has HIV but is well controlled and has undetectable viral levels, meaning that the number of viruses in the blood is so low that is not showing up in the test, then you don't necessarily have to be on PrEP. You don't need to take precautions as long as that person is well controlled. This is very, very important because I don't want you to misquote me. If somebody, your sexual partner, is well controlled with undetectable viral levels, you do not need to be on PrEP. But if you're not sure, or that person doesn't really take their medications, or either way, then please make sure you get on PrEP. So then you have two other options that are injectables. The commonest one will be cabotegravir. Cabotegravir is an injection that you take twice every other month. So every 2 months you come to the doctor's office and you get the shot. And so these are long-acting antiviral medications. These are all HIV medications again. But so it will work for maybe people that don't really like to take pills, but you have to come in every 2 months to get your shot. And then just about 2-3 months ago, there's a new medication that was just approved by the FDA. It's a new medication by Gilead. It's called Yes to Go. Well, that's the company's name, but it's called lenacapavir. And this is a new HIV medication for PrEP that was just approved about 2 months ago. And is one shot given every 6 months. So, that's just incredible, right? So you don't have to take a pill every single day, or you don't have to get your injections every 2 months. This is something that you can take one shot every 6 months. But it's not everybody that kind of qualifies for that. So we will take a quick break, and when we come back, then we will talk a little bit more about PrEP and then PEP, which is post-exposure prophylaxis. Thank you for tuning into Medical Class 901, a show where we discuss the common infections we see in our communities. I am Dr. Chinelo, animal infectious disease and HIV specialist. So remember to tune in to Xfinity Channel 17 and 1091 on Mondays at 7:30 p.m. So see you then. Welcome back to Medical Class 901 with Dr. Chi. I am Dr. Chinelo Animalo, infectious disease and HIV specialist. And on this episode, we are talking about prevention of HIV. And we just talked about PrEP, what that means, the category of people or individuals who would benefit from PrEP. So just a quick recap, PrEP is something that we give to people who are high risk for contracting HIV. And these are medications, HIV active medications that come in pill forms or injectables. The pills forms you take once daily, and then we have 2 injectables that you take. One of them is every 2 months injections, and then the other one is a newly approved medication. It's called Yes2Go by Gilead Pharmaceuticals, where you get injections once every 6 months. So we're going to talk about PrEPs, right? So PrEP, remember we said is pre-exposure. So they basically in a situation prior to exposure to the infection. Now, what happens post-exposure, right? So let's talk about PrEP. PrEP stands for post-exposure prophylaxis. We again talked about what prophylaxis means. It's just the medical term or big fancy word for prevention or transmission of infection. So that's what prophylaxis stands for. So PrEP would be medications that we give after a possible exposure to HIV. So the commonest scenario might be someone that you already had some sexual relationships with someone with unknown HIV status, and you don't know if they are HIV positive or negative. Then we will put you on PrEP. These are HIV medications. Another scenario would be for healthcare workers such as myself, and other doctors who during surgery might have a splash where they come in contact with bodily fluids of a patient who perhaps maybe is HIV positive, or we don't know what the HIV status is. Or it could be a nurse who was trying to put in an IV on a patient and then accidentally pricks herself. So any kind of scenario where you have unanticipated exchange of bodily fluids, you would qualify for PrEP, which is the post-exposure prophylaxis. And these are basically, again, classes of medications. They contain several HIV medications in one pill, and then you might have 1 or 2 other regimens that will require you to take more than 1 pill, perhaps 2 pills. And what they do, again, would be to kind of prevent you from getting that infection. So since I work in the healthcare setting, let me talk about, perhaps, a doctor who accidentally during surgery was splashed with blood from a patient who is HIV positive, or we did not know what the status of that patient is. What would that doctor do? So what that physician is going to do would be, to quickly give us a call, hey, this is what happened. I came in contact with blood of a patient. We don't know the HIV status, or perhaps it's somebody that's HIV positive. And what we do would be to put him immediately on post-exposure prophylaxis with one of the various regimens or drugs that we have available for that. And so we will basically do a baseline HIV test, and then have that person take that medications for at least 28 days, and then we retest and make sure there's no conversion from normal status to HIV status. The time of initiation of these medications is so important. So don't wait for 1 week later, after thinking about it. So if you find yourself, you don't need to be a physician. I just use that as an example. It could be, so things happen. You went to the club, you ended up, in bed with someone, and you don't know their HIV status. Please go to the nearest, hospital, emergency room. You have organizations. You could Google that. Health center. For those of us that live here in Memphis area, go to the Shelby County. Go anywhere that's close to you, and say, hey, this is what happened. I need to be put on medication to prevent me from getting this infection, and they would do that. So one of the questions that we tend to get a lot in the healthcare setting would be, hey doctor, what happens if I don't have insurance? So we know that these are costly medications if you have to pay for it out of pocket, but thankfully for those that are insured, the major insurance carriers here in the United States, they all cover for these medications. So hopefully that should not be a problem. Now, if for some reason you are uninsured or you don't know what your insurance status is, please go to your nearest health center. You could go to Shelby County. There are organizations around here in other cities, things like Friends for All. There are so many organizations that support people living with HIV, and they have these medications they can make available to you. So I'm not just talking about Memphis, so even if you live in a place like, for instance, Houston, where this infection is now rampant, just check, the best thing would be go to your nearest healthcare center and let them know, and they'll be able to plug you into their system or into another system, be able to direct you to where you can get this medication, bearing in mind that time is of essence. You have to take this medication as soon as possible, preferably within 72 hours from the time this has occurred to the time where you take the first dose of the medication. Then something else I would like to stress on would be what we call in the medical field, we talk about non-compliance status. And what that means, non-compliance basically means when you're not compliant with taking your medication as prescribed by your doctor. So when I say this is a pill or pills you have to take daily, preferably every 24 hours around the same time, that's when it works best. So let's say now that you actually high risk for contracting this infection, you take the first dose today, you take the second dose tomorrow, and then you're like, I don't feel like taking any more medications, and you decide for the next 7 days, I don't want to take any pills. My friend, the chances of you contracting this infection is now high, but you can't blame that on the medication. You have to take responsibility for your own part. So that's why we do that counseling and we, talk about compliance. You have to take the medications to give the medications chance to work for you. So as a healthcare provider, what do we do for our patients who we put on either PrEP or PEP? We follow up with you in the office. Usually every 3 months, like I said earlier, we want to check your status. We want to make sure you are still HIV negative. Why is this important? Let's say that you skipped, from your 28-day pill regimen, you skip a week or 2 weeks, and then, we find out, oh, you're HIV positive. What are we going to do, right? Then we will have to take you off PrEP and actually put you on real medication. So compliance in this period is very, very important. Be it if you're on PrEP or if you're on PEP, compliance with your medication is very important. So these are things that we will check upon when you come to the doctor's office. Then some of these medications, like every other thing we take, be it Tylenol, ibuprofen, it doesn't matter. Every medication comes with their own side effects. So your doctor would also check your kidney functions, check your blood count and check other things for other STIs, other infections like hepatitis, and treat accordingly. Sometimes, depending on, other medical issues, let's say somebody, has hypertension or diabetes, we, pay close attention to your kidney function and, to make sure that we are giving you the optimal care and not causing you any harm. So I hope this is, a very kind of quick breakdown of what the role of PrEP and PEP in HIV management. So I'm gonna encourage every single one of us there, please be safe, know your status, get tested, get treated, and if you're positive for any reason, get plugged up for PrEP, for PEP, or for treatment. So thank you for joining our Medical Class 901 with Dr. Chi, and we will see you next time. Thank you.
Thanks for watching the Medical Class 901 with Dr. Chi MD.